Hello, my name is Kayla Sutton, and I'm a family nurse practitioner student at Arkansas State University. I first want to thank Mrs. Ottysha Hadley for her guidance and help with my quality improvement project. My project is on the prescription adherence of JNC 8 guidelines for treating hypertension. About 78 million Americans ages 20 and older are currently treated for hypertension, making this disease one of the most common reasons for primary care visits. The CDC identifies high blood pressure as a primary contributing cause of death for more than 410,000 Americans in 2014. Annually, statistics have shown that hypertension and costs include more than $48.6 billion each year, including the cost of healthcare services, medications to treat high blood pressure, and missed days of work. Hypertension is known as a silent killer due to most patients having no symptoms but being diagnosed during a routine checkup with a primary care provider. The 8th Joint National Committee, also known as the JNC 8, released new evidence-based hypertension guidelines that discuss treatment, targeted blood pressures, as well as medications for managing hypertension. In the non-Black population, initial antihypertensive treatment should include a thiazide diuretic, calcium channel blocker, angiotensin-converting enzyme inhibitor, or an angiotensin receptor blocker. In the Black population, initial treatment should include a thiazide diuretic or a calcium channel blocker. The purpose of this study is to compare the percentage of adults with hypertension being treated in accordance with the JNC 8 guidelines in a rural clinic in Arkansas to the adherence of the previous JNC 7 guidelines being 75%. Methods: this was a descriptive study conducted at a rural clinic in Arkansas through a retrospective chart review. 50 electronic charts were randomly selected between January 1st, 2019 and November 1st of 2019. The population included adults ages 30 to 60 with a diagnosis of hypertension. Inclusion criteria included both male and female patients, adults ages 30 to 60 years of age, and the diagnosis of hypertension, which is the ICD-10 code I-10. Exclusion criteria excluded adults less than 30 and greater than 60 years of age, and patients that did not have the diagnosis of hypertension. The findings concluded through the data analysis that out of the 50 charts reviewed, 90% of patients ages 30 to 60 years of age were treated in accordance to the JNC 8 guidelines in a rural clinic in Arkansas. Discussion and action plan. The results of this study concluded that the adherence of the JNC 8 guidelines for hypertension was higher than the average of 75% adherence to JNC 7 in this rural Arkansas clinic. Following evidence-based guidelines will provide a standard of care for all patients for hypertension. Future research is indicated to no adherence for a larger number of providers since this was only covering one provider. Control of hypertension will lead to decrease in yearly cost of treating hypertension and the incidence of comorbidities and deaths. The limitations of this study included that it was a small sample size of only 50 patients, data collected only in one rural clinic, and data collected was only collected from one provider. That concludes my presentation on the prescription adherence rate of JNC 8 guidelines in a rural clinic in Arkansas. Thank you.